Well, good evening, everyone. My YouTube famdamly. This is video number 2. It's taken a while for me to get to it, about a month. Been having some really big issues, and I'll explain that a little bit in depth. I'm going to try to keep this video down to about 10 minutes because none of you want to listen to me pontificate for for more than that. In fact, maybe even not even that long. So I covered quite a bit of stuff in my first one, and really it's just a journal for me to get things off my chest. But I'm hoping that somebody can find a nugget out of what I have to say, and that maybe you can get some help with grief or some kind of loss, and maybe some mental difficulties you're going through, maybe something with medical issues, and you need some encouragement to persevere. So again, this is a journey about my love, my adversity, loss, and rebuilding. The love, that's a given. That was my wife. Most incredible woman ever. And I'll never forget her. I'll never stop loving her. But at some point, I have to let the physical nature of her go and just hang on to her here in my heart. And that's going to be really hard. And I was told today by a very wise individual. I'm laughing because I don't know why I'm laughing. Maybe it's a nervous laughter. That I'm in the end stages of grief, which is depression. And I am having some issues with that. And I'll explain that in a little bit. I did want to say that I am back from a really nice cruise with my niece, Nikki Lynn. Was supposed to be her and her mom, but her mom had to back out for some medical reasons. But hey, look at this. She got me this little manta ray, and I absolutely love it. I'm not very bright. I call him Ray. Yeah. But we swam with manta rays out in the open ocean and fed them squid, and the most incredible thing I've ever done. Swam with manta rays and manatees and dolphins. Just had a wonderful time. Just absolutely had a wonderful time. I was snorkeling on the first day. Pardon me. And I came back, and just before I stood up out of the water, I saw, I don't know, a rock or something. I wanted to see what it was, so I dove down. It was this gorgeous conch shell. I mean, this thing was just beautiful. So I picked it up, rinsed it off, carried it up with me, and come to find out, you can't take those off the island. So it was confiscated. Bugger. Anyway, I wanted to go into kind of a descriptor of the adversity that I've been through, and how it affected my wife, and how it is currently affecting me, because before I went on my cruise, I was in the ER with a bowel obstruction. Good heavens to Murgatroyd. So I was there for 4 days. Week later, maybe 2 at the most, I think it was about 2 weeks, back again for the same thing. I didn't have to stay in the hospital, so I'm thankful for that. And just enough time after that I was able to get to a point where I could go on my cruise, because I was scared to death I wasn't going to get to go. In any case, got to go on the cruise, and I'm absolutely thrilled, and thank the Lord that I got to go, because I had a good time. But because I was maybe weakened a little bit, I'd get back. I had a great time during the day, wonderful time spending with my niece, Nikki. But I'd get back to the room, and the depression would set in because I couldn't share it with my wife. And that was hard. Oh, my goodness, that was hard. I had some semi-sleepless nights, a lot of tears, and a lot of, how am I going to let this go. You know, grief is hard, but it's really just love refusing to say goodbye. I read that, I think, on Facebook or somewhere like that. And I just thought, okay, yeah, that makes a ton of sense. So the adversity is I had those 2 episodes before I went on the cruise. Just last Friday, I had a severe dysautonomic event. I'll describe that in a minute. And that brought on severe depression. And my depression was twofold. First half of that was I allowed my grief to dig its ugly little fingers into me, and I was full on in tears, and nobody ever told me that grief is painful. I mean, physically painful. It's terrible. The second half of the depression was when I can't exercise and try to be as healthy as I possibly can to eliminate these dysautonomic events or reduce their severity. That's depressing to me because I worked so hard and I was doing so good for so long. I must have had at least a couple of months. You probably saw my ridiculousness on Facebook, and I posted I rode here, I walked there, I started weight training with a personal trainer, blah, blah, blah. So I'm going to go into detail a little bit about dysautonomia. Mine is surgically induced dysautonomia. So anybody out there that has a dysautonomic issue, whether it's MCAS or POTS or Ehlers-Danlos syndrome, I mean, there's a whole bunch of different variations of dysautonomia. Mine is semi-generic in nature, but my nerve highway was severed by all of the surgeries I've had. I've had 13 of them, if we're counting. So I've been through a lot. I had a little mini stroke 3 years ago on top of the dysautonomia. So I'm really battling, trying to get better. It's a struggle. I consider myself fortunate that I am able to push at times, not always, but at times. And I just found that the harder I push, the better I get and the stronger I am, because I'm looking for energy and stamina, 2 things that I severely lack in because of the dysautonomia and the surgeries and blah, blah, blah. Maybe it's just partly old age, but I'm determined to beat this to the best of my ability. I was told by the doctor, just don't expect anything beyond 75% of normal. I think I said in the last video, what's normal? I'm looking for it. If you guys know what it is, sure as heck isn't me. Anyway, so dysautonomia affects everything in my body. My brain does not talk to the rest of my body. Body temperature, heart rate, breathing. I get pain, might be in my chest, might be in my legs, might be in my gut. Forgive me for being gross. Urination and bowel movements and heartbeat, rapid blood pressure, up, down. It just affects everything that we take for granted is affected by dysautonomia, and it's really tough. By the way, if you saw my first video, and hopefully more people will see this one, I have a new background, and I wanted to show off my wife's talents. The mantle was her idea and her design. The items on the mantle were her design, of course, and the painting behind me, it's a pour painting, and they were done at least a year apart from one another. And she somehow duplicated it so that you've got to get this 3D effect, because there's one painting that sits about 1.5 inches off of the other one. And I just think it's the coolest thing on the planet. But I wanted to show off her talent, and that's my background moving forward for the videos. So again, I am trying to journal my journey, if you will, in hopes that somebody finds something. So I've not been able to walk. I've not been able to cycle. I've not been able to do any weight training. and I can feel myself getting weaker by the minute. So I'm hoping tomorrow that changes and I can move forward and I can start returning slowly, of course, to my exercise routine. And I push very hard and I push beyond what I should, and I know I'm pushing too hard, so I might trim it back a little bit. But I push hard enough that my body says, hey, don't forget, I have the power to send you to the ER. Great, thanks. Body's always trying to kill me. I don't know why. So I want to encourage you, if you have any mental issues, physical issues, surgical issues, whatever you have, being physical in nature and getting yourself out there. And if you go for a walk, I don't care if you're using a cane or a walker, or you're in a wheelchair, get outside. Try to enjoy what's around you. And try to do the five senses. What do you see? What do you taste? What do you smell? What do you feel? What do you hear? It's very grounding. Try diaphragmatic breathing. Try lots of different things. Somebody might use CBD oil without THC in it to help calm you down. I use an herb called ashwagandha to help my anxiety. Unfortunately, my depression got so bad on Friday that they're asking that I see a psychiatrist, which I'm going to do because I need grief counseling, because I lost my grief counselor about 3 months ago. And they want me to join an intensive group project. It's 3 hours a day, 3 days a week for 8 weeks. It's very intensive. But they have an evening session for professionals, people at work. So I'm going to try it. Wish me luck, because I'm scared to death. But admitting that you are depressed is the first step. Drug addiction, alcohol addiction, whatever the problem is. I'm trying to be a really open book so that somebody can say, hey, if he can do it, and he's a dork, maybe I can do it. So that's really what this is all about. So I'm already at 12 minutes. I went way over what I thought I was going to. I'll try to get into more details as each video goes along. But I think what I'm going to do is, besides my new background, my new studio, if you will, I am going to end each video with a tagline. Yes, it's dorky. That's just who I am. But bottom line is, I'm Uncle Charlie. I've got your back, so get out there. Go do something. Go make yourself feel good. Find a way to get beyond where you're at. Take care. I hope to see you in the next video. Please go to YouTube. It's Charlie Journey. A Journey Begins. That's the name of the YouTube channel. I know it's lengthy and weird, but that's how you'll find it. So like it, subscribe if you dare. But if somebody subscribes, at least then I'll be able to keep putting these out there. And I hope to branch out and do some other videos about some other subjects. But for now, it's my journey and how I'm dealing with moving forward. So Godspeed to everyone. Take care. I'll see you in the next video.